I'm here with Dr. Kimberly Flemke. I'm so excited to have her here. Kimberly, why don't I let you say who you work with and what your specialty is?
Sure. I'm a licensed couple and family therapist. I've been practicing for almost 30 years. I specialize in couple therapy, sex therapy, and trauma. I'm also a Reiki master and an energy practitioner. So I am very holistic in my approach. I am launching a course specifically for couples, helping them transform their conflict into connection. I'm very excited about it. It's unlike anything that's out there. I'm combining both the best of my field in couple therapy with energy psychology techniques, which are extremely fast in producing results. I've run it now a few times with clients and the results have been amazing. I'm encouraged because I really want to help couples who get stuck. I've been practicing almost 30 years. There are things we can't do in therapy, but I can in a course. I used to be a professor for many years in the Department of Couple and Family Therapy. I'm bringing the best information to people because I believe couples need more information to build healthier relationships.
Oh my gosh, you are so right. It is the hardest but most important relationship in
Right.
your
And there's no
life.
manual.
And it's so easy to just isolate yourself within the relationship.
Yes.
And I think being able to take those conflicts and have tools to turn them is going to
Yeah.
change lives.
The
I'm
tools are the
so
game
excited.
changer.
They really are because it's one thing to wish that you could ask your partner a question, but it's another to actually know how to do it.
That's the truth. When resentment starts to build, it's like a brick wall. And so, one of the first things I do with couples is try to take down the bricks. If there's not emotional safety, you're never going to feel able to take the risks necessary to become vulnerable and open up and ask the hard questions and share your feelings.
Well, I love that you brought resentment out first because that is probably what I hear from my clients is the main problem in their relationships after they struggle through a baby loss. They are resentful that he gets to just go back to work. He didn't have any of the physical changes. People aren't looking at him and judging how his grieving is going, and he
Yeah.
grieves, but not in the way that I grieve. And that makes me mad. What would you do if you were feeling that kind of resentment? What's the first step to start getting that connection back?
I think your niche is so important. There's so many women that go through these experiences and have no one to talk to about it. And in the relationship with their partner, if the partner is not grieving the same way, and likely they're not, that does create resentment. It makes you feel even more alone. I think grief is one of the most misunderstood experiences in a relationship because it can take on different forms, and then the partner may personalize it and they don't understand it's really fueled by grief. So, if you could use that lens. So, back to your question, I would recommend having someone to talk to, possibly a professional, or even just journaling.
Mhm.
Journaling is a cathartic way to get out the pain that is building up. I think of a hot water tank, you sometimes just have to turn the valve before it explodes. So just
Yeah,
like even writing daily, everything that's coming up is like releasing some of that pressure
I
because it's
love
going to come
that.
out one way or another.
I teach my clients to do brain dumping. I just think, I mean, I'm not a great one to just sit with a journal, but for some reason, making lists and
Mhm.
writing out what is actually on my brain, no matter how random and crazy it is, it does really help.
In addition to that, I will have my clients do a free write. I'll say, let's start with this sentence. The reason I hate my partner right now is dot, dot, dot. For 20 minutes, you just keep writing. You don't cross your T's, you don't dot your I's. It has a way of accessing parts of your brain to let out things you guard against. Just let it out, rant, let it all out. When you're done, it just helps you feel like, oh, I can breathe again.
Yeah, it's so good. Yeah, you're right. I think it does. It has you accessing these parts of like, why am I worrying about this? But it came out on the paper.
Exactly. No
Yeah.
judgment, just let it out.
So what do you think keeps people stuck and keeps people from communicating? Like, is it the lack of having the words to say, or is it something else?
That's a great question. There are so many ways to answer that question. Obviously, not having the tools to know how to articulate in a constructive way. We all know how to do it destructively. We all know how to
Mhm.
fight. We all know what that looks like when it's done. You're dealing with the aftermath, and then you don't even know how to come back to it. All of us are imprinted by our growing up experiences. It's impossible not to be. There's research that shows, there's therapeutic models that show, like, as a child, the theory is you come in as a blank slate. We're imprinted by the parental dynamics and how
Mhm.
they interact with us. And then subsequent research suggests also by how they deal with our siblings. That all imprints us. Later in life, we will find a person who is unconsciously familiar to what we know. And then you pick up where you kind of left off. And all those not so healthy patterns often
Mhm.
emerge. And it's not to blame anyone, it's just that's what you know. And so a lot of the work is learning how to make the unconscious conscious so then you can make more of an intentional decision how I want to react. The biggest game changer for me is learning how to self regulate because we all get triggered. But if you don't know how to just calm yourself down just for a breath, it can go really sideways quickly. So, learning how to just breathe and be reflective because when we get triggered, the front part of the brain goes offline. And I always say to couples, if it's heating up, one or both of you just say time out. Research shows at least 20 minutes before the brain can go back to a place where we can communicate again, reflect on your actions, take responsibility. When we're in those screaming matches, nothing is getting solved.
Mm. Oh my gosh. As you were saying that, I was flashing back to my own childhood. When my husband and I have an argument, I do turn into that teenager that stomps away and doesn't speak. You go right back there because it's so familiar.
So
Does not solve a single thing,
it just keeps
but it
perpetuating. Yeah.
just feels like an instant reaction. You can't even think about it. So 20 minutes when
Yeah.
things get heated, 20 minutes. That's great
Yeah.
advice. And then what do you think when you are in a period of grief, for
Hmm.
instance, and you're both tiptoeing around each other? Who is responsible for opening up the line of communication?
That's a good question. Obviously, the burden is on the couple. When I have one client, which is a couple, I don't see two people. But in regards to your question, I think whoever needs to share something needs to be able to open that up. Sometimes it's hard if it doesn't feel safe enough. If you're expecting your partner to shut you down, you're never going to do it. So it's important that you both set parameters for what safe space looks like. When can we talk? Maybe we touch base once a week, talking about where we're each at. Then you have a pulse of your partner because when you're thinking one thing, your partner's feeling the other, you're missing each other.
That's great advice too, because when you're hurting, when you're in the middle of a hard season, lots of times, if you're feeling like there's an issue, maybe you're the one who needs to initiate it then.
Because
Because
when we make the
maybe,
assumption the partner's the mind reader, you're setting yourself up for a lot of
yeah,
disappointment.
lots of times I hear from my clients, they'll say things like, I haven't asked him because we just don't talk about it a lot. Even from my own experience, he didn't want me to get more upset, so he didn't bring it up.
So I want to comment on that. That
But
is one of the most common things I see. I hate to make gender specific generalizations. This is
mhm,
the most common. You know, the stereotype men like to solve problems. And the reason I believe is because men are very uncomfortable dealing with something they can't fix. And that triggers an overwhelming feeling of helplessness. If a man could learn how to self soothe that anxiety because they don't know what to do and just be present, being present to a person's grief can be so healing. You don't need to say anything, just hold them, hug them, just be present.
that is the understatement of the year from my audience. I am sure of it.
Yeah,
Because they feel like they need to say something to make it better. And I don't, my husband, I interviewed him last week for my podcast. He kept saying over and over, no matter what I said, it didn't make you feel better. And I was like,
right,
no, there
right,
was nothing you could, no
right,
matter if you had the most profound
right.
thought, it was never going to make me feel. So just know that and let your partner know that it's okay. You don't have to say something to make me feel better because you just
You
can't.
can't. And then that way their anxiety can start to go down. They don't have to fix it. And just to be emotionally present. Like presence is so important when someone is grieving, just so they feel supported, they feel heard, they feel understood. And you don't have to say anything, just being there.
Yeah. What about the difference in grieving? I mean, how do you know when to worry, when to get therapy? If couples therapy, if you just are not seeing eye to eye on the way you're grieving, or even that maybe one person in the couple wants to try again to have another baby and the other one doesn't.
I think any significant loss is a
Mm,
reason for extra
I do
support.
too.
And
I
that's how I
agree.
frame therapy. It's just support. It's
Yeah.
hopefully an opportunity to give you more tools to help you manage what's coming up. There's no silver bullet. With grief, it's always recursive. You make two steps forward, one step back. You never know when it's going to pop up again. You think you're making all this progress, then all of a sudden you're triggered and you're hysterical again. So
Yeah.
there's no judgment on the journey. It's just allowing yourself to experience what needs to come up because you have to feel it to heal it, release it, and let it through. Emotions are transitory. They're not intended to last forever. They just
Yeah.
tell us that there's signals something's going on inside.
Yeah. That's so true. Talk to me about EMDR. I know a lot of my clients are looking into it, they're curious about it. What are the benefits and tell us a little bit about how it's done.
I love, love, love EMDR. I got trained in EMDR almost 30 years ago. So, EMDR, the acronym stands for Eye Movement Desensitization Reprocessing. We now know that acronym is irrelevant. The way that I remember the story of how it came about was Francine Shapiro, who is the founder of EMDR. I believe she was in her doctoral program, and for whatever reason, this is how the story stuck in my brain. She was walking through Central Park, and she had just gotten diagnosed with breast cancer, some bad news medically. As she was walking through the path, her eyes kept going back and forth, and she noticed that she would start to calm down. The more she kept thinking about the upsetment of being diagnosed with cancer, her eyes kept going back and forth and she would feel calm. And so that turned into her dissertation of studying the eye movements, which 35, 40, 50 years later, we know it's not necessarily eyes, it's anything bilateral, bilateral stimulation. You can do like this, now virtual, you can tap like that. But we have two hemispheres of the brain, the right hemisphere, the left hemisphere. We know the right hemisphere is where we hold most of our emotion, the left is more logic and reason. Whenever there is a trauma, it's unable to go from the right side into the left side. And that's what EMDR does. The lingo is it metabolizes it, right? So you're
Mm,
never going to forget your trauma, but by the time it goes from here over to here, you're going to see it much more neutrally. And EMDR is amazing how it corrects the distortions in our brain. I never get bored doing EMDR ever because I'm amazed at how the brain will produce these things with clients. Unbelievable results. It's miraculous. It's really one of my favorite techniques.
and important in trauma too, right? Because
Oh
it's not
yeah.
gonna go away.
It's one of the most effective trauma treatments.
Yeah. Like this experience is not leaving you.
No.
Where
But
do
I
you
want to say
put it?
something about that. You can't
Hmm.
EMDR is not designed to get rid of grief because it's a
Hmm.
natural process to loss.
Yeah.
However, if you have extra baggage layered onto it, like guilt, it's your fault, you did something,
Yeah.
that would help clear that up because it's not true. And grief is a natural process which needs to run its course. But yeah, so I just want to make that distinction because
That's great.
EMDR is not
No.
a it won't save you from the sadness, but it will help you process anything distorted.
Which is great to know because I think a lot of people are like, I got to get EMDR. That'll make it all better.
No.
But it'll make some of the symptoms better, like that overwhelming feeling that it was your fault or that you
Yes.
should have done
Yes,
something
yes.
different and
All
those
those cognitive
thoughts.
distortions begin to
Oh,
correct themselves in the process, and that is priceless.
once you let that stuff go, you can start sleeping better, you can
Yes.
start breathing.
Yes.
That's when you are able to step into the new person that you are since your
Yeah.
loss. What do people need to know that you think they don't know? What's the big secret about couples therapy that if everybody knew
Mhm.
about this thing, that everyone would be in therapy?
You are the perfect segue for me to tell you about my program because I believe this wholeheartedly. And that's what I'm saying. It's not out there. When you are consistently hooked in conflict with your partner, and we all argue about stupid shit, but when you have those main arguments and they just keep coming up over the years, I can guarantee you it is linked back to a limiting childhood belief.
Mm,
And it's always about ourself. When we perceive something, then we try to write a story about it. And I'll always say to my clients, what is the story you're telling yourself right now about your partner? Because
mm,
what we tell ourselves becomes our reality, whether it's really true or not. If you can learn to clear those beliefs, and I'm an energy practitioner, I do a lot of tapping and EFT, you clear that, you see that's not true anymore. You're not going to get hooked in your conflicts anymore. And it
yeah.
dramatically shifts the dynamic of a couple.
So interesting. And that's what you're going to tackle in your course.
Yeah, that's the main focus in the beginning. And then we start laying all the big foundational pieces for building a really healthy relationship.
Amazing. I will have all kinds of links here when you have it ready. You're a couples, marriage, family counselor. What are your thoughts on talking to older children about the death of their sibling who they've never seen? They
Mhm.
only imagined what they would be if they're old enough to understand that. Is it something that you recommend we do? I know I did it and I was thankful that I did, but I know some of my clients are reluctant, probably for the same reason that we don't talk to our partner enough about it. We don't want them to become upset or
Mhm.
have thoughts about something
Yeah.
that they can't change.
Yeah, that's a really great question. For me, and this is more personal than clinical, I can't imagine having that conversation with a child if I didn't have a spiritual framework. I don't know what I would say to a kid
Mhm.
about your sibling is gone. I don't know. Like, I think it's much easier to frame it for a child like, your brother or sister, they were coming, something changed, and now they're waiting for you in heaven, or something like that. So it's more of a peaceful association versus something that's traumatic. I'm not saying that's the
Faith
only
and
way. I
I
just don't
know.
know of another way personally.
I always encourage my clients to talk about the baby and to remember them.
That's nice.
Just even every now and then say, oh, I wonder what the baby would think about this TV show or whatever. Just even in general conversation. I think for two reasons, because it helps them remember, it helps them not have those feelings of like, oh, I don't dare to say anything to mom about
Yeah,
the
it's
baby
too
because it'll
taboo.
make
Yeah.
her too upset.
Yeah.
And my boys were good about asking questions, not always at the right times. Sometimes it was hard, but they would ask questions. And I thought that was such a gift to have someone else remembering them with,
Yes, I think that's really nice. And I've had other clients where they will do a little ceremony on their birthday, like
mm,
let some balloons go, just a way to remember them as part of the family.
or maybe include their picture in a family
Yeah,
picture or
yeah.
some. So things like that, as in your professional opinion, are not harming children.
I don't think so. I always start with the genogram. I explain to clients it will seem like a family tree to you, but for me, it's a clinical tool and it helps me track patterns and I get to see you in a bigger context. So when I go through the family tree, I'll always ask, were there any deaths, stillbirths, any miscarriages? Because it's funny how sometimes it can actually affect a child without speaking about it. They
Mm.
won't know why there's this void and they just know not to talk about it. And so when I see it on a genogram, it helps give more context and understanding if that was a part of their situation.
It's such a legacy, really
Exactly.
is. And for as discounted as it is in society, it runs deep.
It's such a tremendous loss that it
Mm.
just doesn't get enough press. So many women go through it. It's a part of her and it's now gone. Like you build up all these months of excitement and joy, and then it is devastating.
What do you say to the women who are, they've lost their zest for life? Because truly, there is a very measurable line of who you were before this happened compared to now. What it what could a woman do? Like lots of my clients struggle with their career. They don't want to go back to
Right,
work anymore. They don't have the
right,
passion for it anymore.
right.
Their friends, like, and a lot of times they think it's something wrong with them.
Hmm. Yeah, you're right. I hear that too. If it can be reframed as this is an opportunity for you to rediscover who you now want to be. You will
Mm,
never be the same. You will
yeah,
always be changed from this. It is a forever long experience. But who do you want to be from this? It might cause a shift in careers. Like you're
yeah.
not going to probably care about the stupid crap you were so worried about before. You have different perspective. So it's really, I think, a great way to go inward, doing things you never did before. Maybe you try meditation, yoga, different ways to access things inside that have not been developed yet.
I love that. I agree. It is such a profound shift, but it's not always bad. It gives you this amazing perspective in life of what is really truly
That's
important.
exactly right.
Women who don't go through this may not have. And not that I recommend it, but
Right,
it
right.
definitely does shift you into focus. It's important.
And it gives you permission to just decide that's how I'm going to spend my time now because the rest doesn't matter.
Yeah, it doesn't. It doesn't matter. So, is there anything else that you think would be important for stillbirth moms to know coming out of this, going through the motions, trying to rediscover who they are now since their loss?
Yeah.
And dealing with their relationships.
I think an invitation for therapy is when you feel stuck in your grief, when you
Mm,
feel like it's not moving, then it's really important to reach out for more support. I think in general, the studies I've read about grief, it's that first year, which, it's just, you're a train wreck, but it still takes another year before you start to feel like you're back to yourself. So I think being patient with the
right.
process is really
That's
important. I'm not going to feel like my old self for a long time, and that's okay.
That is great advice because you're right. It is at least 2 years. And then we start judging ourselves. So give yourself the time. This is going to be at least a 2-year process, and that's okay. Just
Mm.
really give yourself permission. That's great advice.
And in addition to that, having the partner understand that timeline.
Mm,
Because if he or she is trying to rush it, that will cause resentment because they're not able to do more than they can do. You are showing up the best way you know how, and they need acceptance and patience and understanding.
oh my gosh, that. Yeah. Because so often, especially if you have other children, people are like, you should be so
Yes.
thankful. You should be so
Yes.
thankful. You already have two
Oh,
children.
yeah.
And it's not fine.
No, it's not fine. People think they're saying the right thing or meaning well, and the
Oh,
stuff they say is, oh my God.
for days I could
Yeah,
talk about it.
I'm sure
Yeah.
you could.
It's shocking. Some of the things that I hear people say. How have we not evolved in this? We're so sensitive about so many things that we say now, but we
Yeah,
still.
I feel very helpless dealing with grief. I
Mhm.
mean, it's one of the most taboo topics. No one wants to
Yep.
bring it up because they're afraid that they're having a good day. I don't want to bring it up. And I always say they are thinking about it all the time. You don't have to avoid the topic. You can ask how they're doing. How are they feeling about that? Because I promise you, it's on their mind. They're just masking it for you. But you have to get through that feeling of anxiety and feeling helpless, like you don't know what to do with their grief. You don't have to do anything with their grief. Just show up, just extend some care.
Yeah, 100%. Everyone in the world needs to be taught that for sure. Well, Dr. Kimberly, thank you so much
Oh,
for
you're so
this.
welcome, Jen. This was so
I
fun.
love spending this time with you, and I cannot wait for your course. It's going to be
Thank you.
so, so important because we need more tools of everything in life. Life is difficult on its own without having support and help from people who have been there and have effective tools to help you. So I'm so grateful for you and the work that you're doing. And
Thank you. I mean, I'm so sorry for the tragedy and trauma you've gone through, but what you've turned that into now is so beautiful
mm,
because you can connect with these women in a way that other people can't. They desperately need more people supporting and understanding their journey. So I'm grateful for you.
well, thank you. It is a unique experience that I think sometimes has to be lived to be understood.
Mhm.
So thank you.
So
I'm
true.
very honored to do this work.
I'm sure it's a privilege, right? I feel too.
Mhm.